Hello, everyone, and thanks for joining us today for our webinar, The Most Important Part of Your Emergency Kit, What It Is and How to Use It. Today's speaker is Mrs. Rose Dodson. She's the CEO of longtime Perks Vendor Sedation Resource. Rose is an innovator and entrepreneur with over 20 plus years in business leadership, experience in all aspects of business formation, operation, finance, and management. Rose is a visionary product developer and equipment specialist, a prominent speaker on a national level, and she authors several educational articles published in the TDA Journal. My name is Josh Epstein. I'm the marketing specialist here at TDA Perks, and I want to make sure that you're aware of the many benefits of the Perks program. Perks endorses vendors and negotiates discounts and exclusive benefits for TDA members. We also offer various educational content from these vendors on compliance, insurance, PPO negotiations, and credentialing, marketing to starting a practice, and more. So Rose, thanks for being with us today, and let's go ahead and jump right into your presentation. Also, we are going to hold Q&A till the end, so there is a question box on your panel, and if you just type your questions in, I'll make sure that Rose has time to answer them. Thanks, Rose.
Thank you, Josh. Hi, everybody. Glad you guys could join us. I was going to say how's it going, but you can't answer me. So thanks for joining us for this very important topic. I'm excited to share it with you. The most important part of your emergency drug kit, or your emergency kit, not just drug kit, but what it is and how to use it. So many of you probably have a kit that's similar to the one that is shown here on the left side of your screen. This is a new company that we're going to be working with, Protect It. We'll be sharing a little more about that at another time, but you know, this is a great box, a great kit that you need to have all the essential drugs for medical emergencies. But what we're going to talk about today is outside of the box. So emergencies in the dental office, there's been several books that have been published about that. Dr. Stanley Bellmet is a well-known publisher or published author. Jeffrey Bennett and Mort Rosenberg also have wrote the textbooks on medical emergencies in the dental office. We're not going to be going through the different types of emergencies that can happen. I'm trying to back up, if you will, my statement that there's a 90% chance that you will use this piece of equipment we're going to talk about. But you'll find that my information that I'm gathering here is coming from either these two textbooks or this special supplement that Jada put out back in 2010 about emergencies in the dental office and managing emergencies. And again, Dr. Bellmet and Dr. Rosenberg were a part of this, in addition to Dr. Kenneth Reed and Dr. Daniel Haas. They did a very good job at putting together algorithms and things that you would need in case of an emergency in the dental office. But they all agree with me that the one thing that you would need is this special piece of equipment. This actually is a drug, but the piece of equipment that you would need to utilize the drug. I'm trying to make this super, what do you call it? Mysterious, this mysterious drug. I know you guys have all figured it out by now, but I think if you'll stick with me, even though you know we're talking about oxygen, you're going to learn something about how to implement it in your office. So if you have not gone to the ADSA website and gotten this free app for emergency algorithms, I really, really highly recommend that you do so. You can download it on Apple, you can download it on Google Play, but it is free and it will walk you step by step through an emergency in your office. So it's really a good tool to have. There's no reason not to have it. I'm amazed that they can put it out for free. You can also go on their website and download the PDF. I actually talked to an assistant last weekend at a clinic, and she said she took the PDF, she laminated all the sheets, and they put it on a little ring by their emergency kit. So they had it at all times. Now, you don't have to look very far when you start looking at this algorithm on this app to see what I'm talking about. So under patient assessment, you'll get right down here, right past the recognition of emergency, position, and looking in the airway to make sure if it's obstructed. The next thing you need to do is assess their breathing. And if they're breathing, you're going to give 100% oxygen. If they're not breathing, then you're going to provide 100% oxygen with a positive pressure ventilation mask, or a BVM. We're going to go through this in detail. So Dr. Mort Rosenberg spoke, and he says that oxygen is of primary importance in any medical emergency. So that's where I come up with my 90% chance, because in any medical emergency, this is of primary importance, and we don't need to just grab our drug kit and forget about the vital drug that is at our hands. We want to make sure that we know how to use it. So supplemental oxygen, it seems like a simple thing. And maybe you have tons of experience with putting on a nasal cannula, but maybe your assistant doesn't, or maybe the new person has not done that very often, and we need to take time to share that information with them. But what I want you to think about here for a second is, okay, do you have an e-cylinder for one thing? That's super important to have in your office, something portable that can be used out in the waiting area if necessary. But if you don't have an e-cylinder and you're saying, well, I'm just going to depend on my nitrous unit, I have oxygen in my nitrous unit or with my nitrous, can you connect a cannula to your nitrous unit? Do you know how to do that? Where would you connect your back valve mask if you needed to resuscitate someone? Do you know how to connect that to your nitrous unit? I'm going to give you some simple steps on how to do that. We're going to look over the entire situation. So first, though, I want to talk to you a little bit about the adjuncts that you can use to give oxygen and what those flow rates would be. So this is a simple nasal cannula. If you're going to use a nasal cannula, you would have a flow rate of 1 to 6 liters per minute. 2 to 4 is optimal, but over 4, you can get some drying out in the nostril. With this cannula, you'll get about 25 to 45% oxygen concentration. So when you connect something to oxygen, usually coming out of the wall, it's going to be 100% oxygen. When we say we want you to have 100% oxygen, if you're using a nitrous unit, you want to make sure that nitrous is completely turned off and you are using 100% oxygen and not a mixture. These are some simple tips about using a nasal cannula that you may not be aware of, and you don't want to struggle with this in an emergency. You want to know this and know how to do this very fluidly. The nares, once they're in the nostril, they need to go face down. So while they're upward when you're holding them in your hand, you want them to go back and down within the nostril. The next thing is the tubing goes behind the ears. And you may not question this, but I always question this. Do I drape this over their head? How does this work? Don't drape it over their head. You can potentially have a choking hazard there. So you want to hook it behind their ears and just snug it up underneath their chin. Okay. Now, there's 2 other adjuncts that you could consider, and one is a standard oxygen mask, and one is a non-rebreather mask. If you're using a standard mask, the flow rate is 5 to 10 liters per minute, and you would get 40 to 60% oxygen concentration. The standard mask is not used as often as the non-rebreather mask. Now, on the non-rebreather mask, you do a flow rate of 10 to 12 liters a minute. That's a lot of flow rate, just so you know. I know that I had a case where I had to put a non-rebreather mask on a family member when they were ill, and they had only had an oxygen concentrator in their home, and it would only go up to like 6 liters per minute. And we couldn't use the non-rebreather mask because we couldn't get a flow rate high enough to fill the bag with oxygen and keep it consistent. And it just kept collapsing. So you have to have that flow rate up to 10 to 12 if you're going to use a non-rebreather mask, and you will get 90 to 100% oxygen concentration. That's what they're going to be breathing in when they breathe. Of course, these are for spontaneously breathing patients. They're breathing on their own. Now, when you get to a situation where they're not breathing, as Dr. Reed said, if a patient has apnea, they're not breathing, it requires positive pressure ventilation, again with 100% oxygen. So I'm showing you 2 devices here, and you'll see the one with the big red X on it. And if you have this in your office, you need to just be aware that it takes a little bit of skill to use this. It needs something that needs to be practiced, and it's not like you have every day someone that's unconscious that you can put this on and push the button and see how to use that. But the demand valve is where you're going to push the button and it's going to give you a puff of oxygen. and then you release it, and then a puff of oxygen, and then you release it. But there's a potential there for an overfilling of the lungs, and also just not getting that tactile feel of what's going on with the patient. So all of the gurus within the industry will steer you away from using a demand valve in an emergency. So the positive pressure oxygen of choice is going to be this bag valve mask resuscitator. You can see we have tubing here, we have a reservoir bag, we have the bag that you're going to push, and then you have your mask that actually goes on the patient. I'll break down a couple of other things about this, but what you need to know is if you don't hook it to oxygen, you don't have tubing, it's better than nothing. You're going to get room air. On room air will be 21% oxygen, but you can push air into their lungs, which is important. In an emergency, you've got to keep that. Your goal is to keep oxygen through their system and into their brain and into their through their bloodstream. So with this, you will get, if you have the oxygen flow rate set from 10 to 25. If you have a regulator that goes higher than 10, then put it all the way up to the max, basically. 75 to 95% oxygen concentration. Now, if we looked back on that, the beginning with the app, the 10 minutes saves a life, they actually say 10 liters per minute flow rate for the bag valve mask. So that is sufficient. 10 liters per minute would be the minimum that you would want to use. Anything above that would be great. So things to know about a bag valve mask resuscitators is there are different sizes. So there's adult, there's child, there's also an infant. I would say that the two you would probably want to have in your office would be an adult and a child. And then you can get multiple sizes of mask to go on the bag valve mask resuscitators. So this shows there's various size masks, and this is like an anesthesia mask, if you will. They all have the same diameter of connector that would allow it to be put onto a bag valve mask. There are options that you can get a manometer port so that you can make sure that you're meeting the AHA guidelines for the amount of pressure that you're using. And then there's also on some of them a port where you can connect CO2 to verify that they are exchanging air. This same port can be used to push medications through. So cardiac medications can be pushed through that port as well. Now, in the absence of those things being on your bag valve mask, you can buy separate adapters, such as this adapter here that goes in line with the mask, and it has a CO2 port on that. If you have a monitor with CO2, you simply connect your straight sampling line to that. There's also a meter dose inhaler adapter that you can put in line with the mask, and then you can give your albuterol in line with that as well. Okay, so one thing that I want you to take a look at here are all of the different connectors on the ends of each one of these. These are connectors that are designed to be used on a, well, I've lost my word, on a port that you would use like for an oxygen cannula. They're all the same. So maybe you have an oxygen unit and a nitrous unit, and you're using it for your oxygen. That's perfectly fine. You can do that. You want to make sure your nitrous is all the way off and that you're giving 100% oxygen. But in the case that you are not going, if you need to use a cannula or you need to use a bag valve mask, you need to understand how you're going to connect that. So in emergency situations where the patient is apneic or they're not breathing, Dr. Bellmet says that he really wants you to have an E-cylinder, and an E-cylinder will provide you for about 30 minutes of oxygen. So it's suggested over and over again that you should have an oxygen cart. And I'm going to talk to you about the regulator and how to connect that, these different ports to that. But on your nitrous unit, and you may not have a portable unit, you may have a unit that is in your cabinet. There's different ways that you can access the oxygen from that to be able to use a cannula, and we want to talk about that. And then you may just have an O2 outlet on the wall. So this is a click style regulator with a standard hose barb. That's that word I was trying to think of a minute ago, hose barb. So those hose barbs is what you would be able to connect either the straight cannula port, or there's threaded ports, as you see right here on the right, the threaded port. So with a threaded port, what I want you to be aware of is we call that a disc port. And some regulators do have a portion that you can screw that onto. But you're going to literally ignore that thread, and you're just going to shove it up on the nipple port on the standard hose bar right there. You're just going to completely bypass the threads. Don't worry about it. Just get the tubing in place securely. That's what you want to do. And so once you get it on there, then you just have a click style here, and you just dial this up to 2, 4, 6. If it's going to be on a bag valve mask, crank it up as high as it'll go. Okay, these other items over here on the left, these are some things you can come back to and refer to later. It's just a breakdown of an airway kit where we also have oral airways and those types of things, which is not part of our topic today, but it's good information to have. Now, let's just say maybe you have an O2 wall outlet, and that's what you choose to use. Maybe you have an O2 wall outlet, and you can definitely get a quick connect is what it's going to take to connect straight into that. And you'll see here on this top right figure, this oxygen quick connect, this has your regulator on it, and it also has a disc port, but we have put an adapter on there, so it just allows you to put a cannula directly on that without having to utilize the disc port. This particular quick connect will fit a Porter or an Accutron wall outlet, which is what we find in most dental offices. Although you'll see on the bottom here, these are medical outlets, and you might have recognized some of these maybe in the hospital or somewhere. These all require a different type of adapter. So if you're going into your standard Porter or Accutron wall outlet, you would need one of these quick connect portions here. And if you're questioning exactly what you need, you can always email me a picture of your setup, and then we can help you determine the type of connector that you need, and we can customize it for you. So if you don't have nitrous, I'm going to say that, if you want to bow out at this point, I understand, but I want to spend some time the next 5 minutes going over these nitrous flow meters and the different ways that you can connect oxygen to them. So you've got a Porter wall mount here. So maybe you have an under counter nitrous unit, but you have a wall mount where you actually can adjust your flow. So you have an O2 outlet here. This is where you would connect your oxygen. Same thing on the Accutron. But here, like on the Porter, you have an O2 outlet here, and you have an O2 outlet on each one of these that I'm circling there for you. You can see that each one has it. So I'm going to break this down. So on the Porter, and you'll see here, you literally have 50 PSIs of oxygen available to you coming out of here. My staff laughs at me. I was doing a training with them on this particular thing, and I said, 50 PSIs of oxygen. I'm not sure how much oxygen that is, but it's a hell of a lot. So you got a hell of a lot of oxygen to come through this. But what you have to do is control that. So that's why you need a regulator. So the regulator with the quick connect would connect right here into this port. Once it's there, you just leave it in the off position. It can stay connected at all times. And you can even put your bag valve mask already connected to it, or your cannula, and have one ready to go, so that if you wanted to use oxygen from your unit, you could. Now, I will say there are 2 versions of nitrous units that are available. There's an oral surgery version, which is a higher flow, and then there's a standard flow. Most of your nitrous units will only flow through a nitrous hood at about 8 liters per minute. So you don't quite get enough if you were just connecting a normal cannula in some other way besides this regulator version to do a bag valve mask. But once you connect this quick connect to it, then you're all set. Now with Accutron, they also have an O2 outlet there on the side, as you can see on this bottom left picture. Some of the older ones are located in a different area. We're gonna break this down and look a little closer at it. So you can see this particular one is in the back between 2 connections. This was difficult to get to, so we actually had to utilize a Slimline Oxygen quick connect in order to reach that and get a regulator so that they could utilize their O2 resuscitator port. This is an Accutron under the counter one, which we customized with a very small, it was a little more expensive, but a very, very small Slimline Regulator. So we were able to adapt that so that they could utilize theirs. Now with Bellmet, it's actually located underneath the flow meter. So you might have to look a little bit on your particular unit to figure out exactly where your connection is. But a lot of them, especially the newer ones, are coming with some sort of an oxygen outlet. Now, what if you don't have an oxygen outlet? If you don't have an oxygen outlet on your unit, you can adapt it with one of these adapters. And this would be where you would just connect it here where your bag T goes. And that would adapt this so you could use your nitrous unit with a cannula or a bag valve mask. Again, these units only flow at about 8 liters per minute. So if you don't have an O2 outlet, I would definitely want to make sure that you have an e-cylinder that is full of oxygen so that you can at least get your 30 minutes out and available 30 minutes of resuscitation time use with your e-cylinder. One caution. You've got your bag that connects on the bottom. If you're going to use one of these adapters, it could overinflate. So you would want to cap off the area where your bag is going to go if you want to use one of these types of adapters with your nitrous unit. So I told you that would be quick. Just kind of a little pop-up webinar that we could go through. I thank you for your time. And hey, I think this little balloon guy needs a little help there with his oxygen. What do you think? Josh, I'm going to give it back to you for questions.
Thanks, Rose. We appreciate that. So again, ladies and gentlemen, you can just type your questions in the question box there on your panel. We've got plenty of time to answer them all. I do see one question that came in, and Rose, so, how long does a bag valve mask last, and is there an expiration date on that?
Great question. At one point, there was not an expiration date on them. So we did a little research on that, and they last about 5 years. So obviously not being used. They are a single use item. Now there are some that you can purchase that are reusable. They're kind of expensive. They're like maybe $400, and it's if you're not using them all the time, you've got to get that mask cleaned and different things. So pretty much everybody's gone with a disposable version. So now there is an expiration date, but it's typically 3 to 5 years, even with that expiration date. What you do want to check though is the mask to make sure that it is inflated. So that's probably the #1 issue, is when somebody grabs their bag valve mask and the mask is not inflated. If you can't get a good seal with that mask, you pretty much can't use the bag valve mask. So you want to check that along with your other emergency drugs and equipment. Make sure your mask is inflated.
Thanks, Rose. So, ladies and gentlemen, I want to make sure that you're aware that this webinar is being recorded, and it'll be sent out a few different times over next month. And I urge you to share the information with your colleagues. There's a lot of valuable information and resources here. Let's hang on for just a little bit longer and see if there's any questions that come in. As of right now, I don't see any, Rose.
Okay. Yeah, well, that means I did a great job, right?
You always do a great job. You always do a great job.
One other thing, Josh, I did put my email address here, Texas Rose at Sedation Resource.
Yeah.
Please feel free to reach out to me. Again, a lot of times I just have people send me a picture of their oxygen setup so that we can determine exactly what they need, because it can vary quite a bit. It's not always a straightforward solution.
Yeah, and once again, my name is Josh, and I'm the marketing specialist here at Perks, and I can help you get in touch with Rose if you need to, or any other TDA Perks vendor. And again, we appreciate your time today, Rose, and everyone else for taking time out of your day and being with us. So thanks again, Rose, and everyone have a great weekend. We'll see you next time. Bye-bye.
Thanks. Bye-bye.
Bye.